Here, okay. So thiazide diuretics interact with lithium, but what do they do to each other? So thiazide diuretics can reduce the clearance of lithium, thus increasing serum levels of lithium, and this can lead to lithium overdose. Also, when it comes to lithium, you need to prescribe lithium with caution in those with QT interval prolongation. Now, when it comes to heart failure with reduced ejection fraction, what are the medications that we can give? So with confirmed heart failure with reduced ejection fraction, you can give BAMs. So beta blockers, ACE inhibitors, mineralocorticoid antagonists, so spironolactone, and you can give an SGLT2 inhibitor such as gliflozins. So empagliflozin, dapagliflozin, not canagliflozin. So this is very, very important to go through for the exam. Now, another point to go through is piroxicam. So piroxicam can cause the highest risk of GI effects, as well as looking at the SADMAN rules. So generally, if you have dehydration or you develop AKI or lactic acidosis because of any one of these SADMAN drugs, so SGLT2 inhibitors, ACE inhibitors, diuretics, metformin, ARBs, NSAIDs, these can all lead to dehydration. So if you have any vomiting symptoms, then you would need to halt these drugs depending on the question. So as I've written, AKI and lactic acidosis can lead to dehydration. Metronidazole and alcohol should be separated by 48 hours. Very, very important point, as they can lead to a disulfiram-like reaction. So all of these points so far, you need to understand these for the Gphc exam. Very, very, very key. So other points to go through are lithium dose. So lithium dose is usually 0.6 to 1 millimoles per liter. Lithium should be avoided in breastfeeding, and hyperthyroidism is defined as high T3, T4, and low TSH, which is an inversely proportional relationship. Methotrexate, you would report any sore throat symptoms. Now, with methotrexate is a dihydrofolate reductase inhibitor. Other points you would report is blood disorders, liver toxicity, and respiratory problems, and report immediately any blood disorders, sore throat, and bruising, as we mentioned, and apply a warm compress for a style. Thank you so much, guys.